My name's Rono Mukherjee, and I'm a consultant urological surgeon. I'd always had an interest in surgery and performing operations, surgical conditions, and the attraction to urology was that the problems were common, very common, whether it's prostate problems in men, recurrent urine infections in women, kidney stones, and it was limited to an organ system, the renal tract. And the type of operations we do in urology is varied and fascinating, and the impact we have on people's lives, diagnosing and treating cancers, treating kidney stones, urinary symptoms, has a massive impact on improving quality of life. And you can see the results of that very, very quickly. So it's a very satisfying profession, a specialty, and it's very rewarding to see the patients in clinic afterwards. I grew up in the west of Scotland, just outside Glasgow. Well, I think as I highlighted, I'm doing a specialty that I personally find fascinating and interesting. I have some excellent colleagues with the same motivation from doctors and nurses and admin staff, and we work very well together as a team to deliver an excellent service, treating patients, as I mentioned, with very common problems and improving their quality of life. The problems in urology are increasing as well, so it's as the general population becomes older, so there's always going to be a demand for urologists, and I find it fascinating. I find it fascinating also to train next generation of doctors and train them to become urological specialists. I'd like to think, and I suppose from feedback, I'm very open and honest. I spend time with them, the appropriate amount of time that they need. I don't like to rush any consultation. I like to get to the bottom of the root cause of their problems. The operation is a fascinating part of urology, and obviously as a surgeon, every surgeon enjoys operating. But to me, the operation starts when you first meet a patient in clinic, when you first ask them in from the waiting area and introduce yourself in the clinic room, and it finishes when you see them post-operatively a few months later in clinic, and you're finding out whether their quality of life has improved due to the intervention, whether it's surgery in the prostate or whether it's surgery in the kidney for kidney stones. I think that relationship you have with patients is very rewarding.